Diabetes is a condition that requires constant management, but certain symptoms can signal life-threatening emergencies. Recognizing these critical warning signs early can prevent severe complications and, most importantly, save lives. While diabetes often presents subtle symptoms, emergencies demand immediate attention. Whether you live with diabetes or care for someone who does, understanding these signs is crucial. In this comprehensive guide, we'll explore 7 diabetes emergency signs that could mean the difference between life and death. Have you ever noticed someone with breath that smells unusually sweet or fruity? While it might seem harmless, this odor is a red flag for diabetic ketoacidosis or DKA, a life-threatening condition. DKA occurs when the body lacks enough insulin to use glucose for energy. In response, it starts breaking down fat for fuel, producing ketones as a byproduct. Small amounts of ketones are normal, but when levels build up, they turn the blood acidic, a condition known as ketosis. This metabolic imbalance is particularly dangerous for individuals with type 1 diabetes. Fruity breath is often the first noticeable symptom of DKA, signaling that the body is in crisis. Why is it dangerous? DKA doesn't just affect the breath. It disrupts the body's entire system. If left untreated, it can lead to severe dehydration, brain swelling, coma, and even death. Triggers for DKA include missed insulin doses, infections, or metabolic stress. Recognizing fruity-smelling breath as an urgent warning sign can prevent catastrophic outcomes. If you or someone you know notices this symptom, seek immediate medical attention. Rapid or labored breathing isn't just a respiratory issue in diabetes, it reflects a deeper metabolic crisis. When acids build up in the blood, the body uses breathing to manage its pH levels. By exhaling more carbon dioxide, or CO2, the respiratory system works to restore balance. However, in diabetes, abnormal breathing often signals DKA or other serious complications. What happens during DKA? When the body breaks down fat instead of glucose, it produces acidic ketones that accumulate in the blood. This triggers rapid breathing as the body tries to expel CO2 and counteract acidosis. This isn't just about lungs, it's the body fighting a life-threatening imbalance. Why immediate action is vital. Without intervention, DKA can cause organ failure, dehydration, coma, and even death. If someone with diabetes experiences rapid or labored breathing, it's critical to seek emergency care. Prompt treatment can stabilize their condition and prevent severe complications. While nausea and vomiting might seem like common, everyday symptoms, they take on a far more serious meaning for individuals with diabetes. Persistent episodes can indicate DKA. Excess ketones in the blood not only alter its pH, but also irritate the stomach lining, causing nausea and vomiting. The science behind it: when the body lacks insulin, it turns to fat for energy, producing ketones. These ketones disrupt blood chemistry, trigger nausea, and lead to dehydration. Why it's more than an upset stomach. Nausea and vomiting are the body's way of signaling an urgent problem. Ignoring these symptoms can result in severe dehydration, electrolyte imbalances, and worsening acidosis. For individuals with diabetes, these symptoms demand immediate attention. Early intervention can prevent DKA from spiraling into a full-blown emergency. The brain relies on a steady supply of glucose to function properly. When blood sugar levels become dangerously high, known as hyperglycemia, or low, known as hypoglycemia, it disrupts brain activity. This disruption can lead to confusion, disorientation, or altered mental states. Why does this happen? Well, in the case of hyperglycemia, elevated blood sugar and ketone buildup impair brain function. On the other hand, with hypoglycemia, the brain is deprived of glucose, which is its primary energy source. Now, why is this critical? Mental confusion is not just a symptom, it's a sign of a metabolic crisis. Without swift action, this can escalate to seizures, coma, or even permanent brain damage. So if someone with diabetes appears confused or has trouble focusing, it's a medical emergency. Timely treatment can restore glucose balance and protect brain health. For individuals with diabetes, fatigue or weakness isn't just a feeling, it's a signal that the body is running on empty. Despite high blood sugar levels, cells may remain starved for energy due to insufficient or ineffective insulin. Causes of fatigue in diabetes: hyperglycemia. Glucose can't enter cells, leaving them without energy. Hypoglycemia. Blood sugar drops too low, depriving the body of fuel. Dehydration. High blood sugar increases urination, leading to fluid loss and fatigue. Why it matters. Fatigue is more than an inconvenience. It highlights underlying glucose imbalances that, if ignored, can worsen over time. Addressing fatigue through blood sugar monitoring and medical care can prevent further complications. Abdominal pain in diabetes is a symptom that requires attention. Often linked to DKA, this pain isn't just discomfort, it's a sign of internal metabolic distress. When the body produces excessive ketones, the blood becomes acidic, irritating the stomach lining. Acidosis and its effects. As ketones accumulate, they disrupt the body's chemical balance, cause stomach pain, nausea, and vomiting, and signal that the body is in crisis. When to worry. Abdominal pain in someone with diabetes, especially when paired with other symptoms like fruity breath or nausea, is a red flag for DKA. Immediate medical intervention is essential to stabilize the condition and prevent life-threatening outcomes. Blurry vision in diabetes isn't just an eye problem, it's a reflection of systemic blood sugar imbalances. Elevated glucose levels cause the lens of the eye to swell due to fluid shifts, altering its shape and focus. Why it happens. High blood sugar. Swelling of the lens disrupts vision. Sudden sugar drops. Quick changes in glucose levels can also affect the lens. Long-term risks. Chronic high blood sugar can damage the retina, leading to diabetic retinopathy, a progressive condition that can result in blindness. Early intervention is key to preventing permanent damage. Understanding the emergency warning signs of diabetes can mean the difference between life and death. Conditions like DKA and severe glucose imbalances progress quickly, making awareness vital. Here's why these signs matter. Timely intervention saves lives. Recognizing symptoms like fruity breath or rapid breathing can prompt immediate action, preventing complications. Prevention of long-term damage. Addressing issues early protects organs, vision, and overall health. Empowerment through knowledge. Knowing what to watch for allows individuals to manage diabetes effectively and respond swiftly in emergencies. How to respond to diabetes emergencies. Monitor blood sugar regularly. Use a glucose meter to track levels. Watch for patterns and spikes. Stay informed about ketones. Use urine strips to check for ketones if blood sugar is consistently high. Seek medical help immediately. If symptoms like fruity breath or confusion occur, don't wait. Visit the emergency room. Maintain a diabetes management plan. Work with healthcare professionals to create a personalized plan that includes diet, exercise, and medication. Prevention tips for diabetes emergencies. Stay hydrated. Proper hydration helps flush excess sugar and ketones from the body. Follow your insulin routine. Skipping doses can lead to dangerous imbalances. Be prepared. Keep a diabetes emergency kit with glucose tablets, snacks, and medications. Educate loved ones. Teach family and friends about diabetes warning signs so they can help in emergencies. Final thoughts. Take charge of your health. Diabetes is a manageable condition, but emergencies like DKA and severe glucose imbalances require vigilance. Symptoms like fruity breath, rapid breathing, confusion, and abdominal pain are not to be ignored. They're life-saving signals from your body. By recognizing these warning signs and taking swift action, you can protect yourself or a loved one from severe complications. If this guide has been helpful, please like, share, and subscribe to our channel for more health insights. Awareness is key, and together, we can make a difference. Stay informed, stay prepared, and prioritize your health. Thank you for watching.